Thanks, Deputy Speaker. I also rise today to speak to the health legislation amendment Improving Choice and Transparency for Private Health Consumers Bill 2026. Now, Deputy Speaker, it would not shock anyone in this House that I believe the Morrison government made many mistakes and missteps in their term of government. Whilst a lot of time could be spent discussing those that made major headlines, one that did not receive as much attention was their failed price disclosure tool, Medical Cost Finder. Deputy Speaker, the Morrison government spent $24 million setting up the Medical Cost Finder website, which they claimed would use Medicare data to display the cost of common medical services alongside the fees that individual specialists voluntarily shared to the website. But how did this work out in practice, Deputy Speaker? By the end of 2022, out of the approximately 6,300 eligible specialists registered to practice in the 11 specialties covered on the Medical Cost Finder, just 6 doctors had chosen to display their fee information. 6 out of more than 6,000. But that was in 2022, so maybe it improved over time. But even 3 years later, Deputy Speaker, only 88 doctors have voluntarily displayed their fee information. Just 88. It is clear, Deputy Speaker, that the system was not working and that this was preventing Australians from being able to access information that they needed when making decisions regarding their health care. This bill before the House fixes this. Deputy Speaker, it is simply unjustifiable to expect Australians to commit to a medical treatment without knowing the cost of that treatment. It is unjustifiable to expect Australians to commit to a medical treatment without being able to compare those costs against the fees charged by other providers. Australians have the right to know the level of support that is provided by their private health insurer so they can determine from the outset their likely out-of-pocket costs. This bill will allow the government to publish details about what individual specialists charge for particular medical services. This information is already collected by government, Deputy Speaker. It's just a matter of allowing it to be published. This move will improve transparency and take the guesswork out of healthcare, helping ensure Australians have all the information they need when making choices concerning the health of themselves and their loved ones. And it does this without increasing the administrative burden on our doctors. Deputy Speaker, this bill also outlaws another practice that is becoming increasingly problematic in the insurance system, which is the practice of product phoenixing. For those that are unaware, product phoenixing is when an insurer closes an existing product, then opens an identical or similar new product at a higher premium. We know that this practice is hurting the hip pockets of Australians and damaging their confidence in the insurance system. That is why we promised at the last election to address it, and that's why we're delivering on that promise. Deputy Speaker, not only does this provide more protections to Australians, it also provides them assurance that our insurance system is working as it should and it's there to support them. Deputy Speaker, this doesn't just protect new entrants to private health insurance, but also the 15.3 million people who currently hold private health insurance policies who are currently left unprotected from this practice. The bill will achieve this by amending the approvals insurers are required to receive from the Minister for Health. Currently, private health insurers are required to apply to the Minister for Health if they wish to change the premium for an existing product. This creates loopholes that have been exploited by providers to maximise their profits and hurt the Australian people. This bill before the House creates changes that will require an insurer to seek ministerial approval for the premium charge for a proposed new product and, importantly, where changes are made that reduce cover, a benefit or a term of condition of an existing product. We know, Deputy Speaker, that the cost of medical and hospital services is a key driver of health inflation for consumers, which ultimately feeds into higher out-of-pocket costs and higher private health insurance premiums. And we know, Deputy Speaker, that fees can vary widely across specialists, even for the same procedure in the same part of Australia. And we know that this is hurting Australians. That is why we promised to address this issue, and that is why we are delivering on this promise and advocating the passing of this bill. On this side of the chamber, Deputy Speaker, we are dedicated to working for the Australian people to ensure that our healthcare system is strong and transparent, accessible for all. If only that was the case for everyone in this chamber, though, Deputy Speaker. Can we really be shocked that we are still here cleaning up the mess of the previous government when they have members on their front bench who still believe that our Medicare system should be privatised, stripping Australians of the quality health care that they deserve? When they have members on their front bench who are committed to talking down Australia and Australians? When they have members of their front bench that are willing to bet against the Australian economy and people? Deputy Speaker, the member for Goldstein has gone on record in this House declaring that Australia runs an illness system, not a healthcare system, stating it is a system designed to keep people ill, to feed the benefits of the unions and the people that they are paid to represent, and to maintain the political control of the Australian Labor Party. Deputy Speaker, he is more obsessed with grand political conspiracy theories and union bashing than he is the healthcare of the Australian people. The only thing that the member champions in healthcare is the privatisation of Medicare. But, Deputy Speaker, on this side of the House, we will champion all aspects of our public healthcare system. That's why I'm proud to stand for this bill. In more specifics, this bill will amend the Health Insurance Act 1973 and the Private Health Insurance Act 2007 to allow for the publication of information about medical practitioners and their billing, including names, locations, fees charged by location, and their utilisation of gap cover arrangements with insurers, where insurers pay a medical practitioner more if they agree to charge no or fixed out-of-pocket costs. Allow for the publication of information about hospitals, including medical practitioners who provide services at the facility and insurers that have gap cover or contracting arrangements with the facility, and allow for the publication of information about insurers, including proportion of policyholders who experience different gap cover arrangements and the out-of-pocket costs under those arrangements. Deputy Speaker, transparency and honesty in our medical system are crucial so that Australians and people in my community are able to make fully informed healthcare choices. Honesty in our system and in how we talk about our system matters. Unfortunately, not everyone in this House would seem to agree with that. The member for Goldstein has in this House declared that there are no bulk bill doctors in this capital city for people. He has come here and claimed that people in my home, in my community, do not have these services. This is a blatant falsehood, Deputy Speaker. I will not stand here and say that there is not more work to do on the bulk billing rates in my community, but to exploit the concerns of my community, which he is a stranger to, for his own political gain and narrative is unacceptable. I'll stand here with every opportunity I have, be honest about the challenges we face and fight for my community, not exploit them and the constituencies of others to suit my own narrative. Deputy Speaker, the member for Goldstein has gone on record in this House saying, let's be honest about healthcare. And I agree, Deputy Speaker, let's be honest about it. Deputy Speaker, there is only one side of this chamber that is committed to fighting for Australians' right to access affordable and accessible healthcare. It's not just this bill that proves it. We've made record investments into Medicare and bulk billing, which has worked to ensure that bulk billing rates Australia-wide are now over 81%, and that 97% of Australians live within a 20-minute drive of a registered Medicare bulk billing practice. Deputy Speaker, the Albanese government has made record investments in our healthcare system, reaching new agreements with the states and territories to deliver record funding into the hospital system. Here in the ACT, it will mean an additional $557 million boost to hospital funding, alongside additional funding of $75 million to assist with the challenges of being a smaller jurisdiction. This is a part of a package that is worth over $4 billion in the ACT, Deputy Speaker. And Deputy Speaker, 12 months after the Albanese government's landmark $792.9 million women's health package, we are seeing real and impactful changes being delivered. This includes the first PBS listing for new contraceptive pills in more than 30 years, the first PBS listing of new menopausal hormone therapies in over 20 years. More than 6,700 women with endometriosis have accessed treatment at PBS prices, saving $4.9 million on 26,000 scripts in the past year. And women undergoing in vitro fertilisation are receiving earlier and more affordable access to a form of fertility treatment, with more than 46,000 women with specific low levels of reproductive hormones accessing 273,000 scripts in the past year. And Deputy Speaker, the Albanese government has delivered the largest cut to the cost of medicines in the history of the PBS, with the maximum cost of a general script falling from $42.50 to $30 in January 2023, and now it's to $25. Deputy Speaker, this Albanese government has established 1,800 Medicare because life isn't 9 to 5, and neither should access to health advice. And Deputy Speaker, in my community, the Albanese Labor government has invested in and established the Medicare Urgent Care Clinic in Woden, the Tuggeranong Medicare Mental Health Centre in Tuggeranong.
Just a moment, member for Bean. I call the member for Lyne. Okay, quorum required. Ring the bells.
Jeez.
Quorum formed. Thank you very much. And I call the member for Bean to resume.
Thanks, Deputy Speaker. This bill is another example of the Albanese Labor government's plan to assist Australians with the cost of health care, to ensure that the last things Australians are worrying about when seeking medical treatment is their wallet. This fits into the broader picture as well, Deputy Speaker, on Labor's commitments to stand in the trenches with the Australian people in the fight against the cost of living. That's why we've also cut student debt, cut the cost of PBS medicines, cut 30% off home batteries to lower power bills, and supported apprentices with 10,000 bonuses, and introduced paid prac for nursing, teaching, social work and midwifery students. Deputy Speaker, I'm very excited to see this latest commitment be delivered and added to that list. I commend this bill to the House.